Thank you for joining us for truly, as you can probably tell, our first virtual ribbon cutting ceremony. We're still figuring out some of the details to make this work, but as we are definitely in a very special of living and learning to live with COVID-19, today's event is definitely taking that into consideration. Today we're going to be celebrating the launch of our first mobile clinic unit for the CareLink team. It's a significant milestone for our CareLink team and for our Healthcare for the Homeless program. Also, though, today it's really important for us during this time of COVID to take a pause, reflect, and also celebrate our community medical center roots, our mission, and our compliments. We're going to be doing this over the next week as we celebrate National Health Center Week. So this is our first event as part of National Health Center Week. National Health Center Week is an annual celebration where we at CMC join 1,400 plus and counting other community health centers from across the U.S. in recognizing and sharing the important role of health centers as we serve over 29 million people in the United States. This year, the theme of National Health Center Week is lighting the way for healthier communities today and in the future. The theme is especially appropriate as health centers are uniquely positioned to provide quality, empathetic care in a time of a pandemic, while we continue to support the vision for a future of healthcare based on equity for all. Today we're going to be celebrating our van, which has been made possible by the generosity of HealthNet, a Centene company, and a key partner in the mission to provide care to underserved members in the community. I'd like to thank Michael Rossman, Senior Committee Relations, representative of HealthNet, who will be joining us today for a special occasion, and he'll be providing some remarks in a little bit. I just have to finish mine. I would also like to thank, of course, the Greater Stockton Chamber of Commerce and the San Joaquin Hispanic Chamber of Commerce for their support today as they stream live our initial ribbon cutting ceremony. I would also like to thank and acknowledge our community partners who, through ongoing collaboration, make our work with in providing health care to the homeless possible. Those partners include today our Stockton Fire Department, very special guests. Thank you so much for joining us. San Joaquin County Continuum of Care, San Joaquin County Health Department, San Joaquin County General Hospital, Gospel Center Rescue Mission, Stockton Shelter, St. Mary's Dining Hall, and volunteers and volunteers and volunteers. In the 1960s, a small group of very committed individuals came together to provide medical care to migrant farm workers in need. The volunteers filled the trunks of their cars with donated medicine and medical supplies, and then intrepidly found the farm worker camps along the sloughs and river of San Joaquin County. The passion and commitment of those volunteers are the value roots of community medical centers. In 2002, with funding from the federal government, CMC, or Community Medical Centers, launched our CareLink program. Once again, a very committed group of staff loaded the trunks of their cars, back seats of their cars, with needed medical supplies and medicines, and went throughout the county, finding, visiting, caring for the persons experiencing homelessness and living along the river and the sloughs of this county. CareLink is a program beginning in 2002 So in 2019, our caroling program provided services to 7,825 homeless patients. More recently, our team has responded to the call from local shelters that need help screening shelter patients for COVID-19. Randy just reported last night that just in July we screened 43, we had 43 shelter residents come out positive with the result. This van today will make a change in how we provide care to the homeless. Hopefully our staff will be able to keep their cars, their vans in better shape as they utilize a van that is well equipped, meant to be out in the community, taking our students the supplies that they need to our homeless patients. So without further ado, I'd like to invite Michael Rossman to come up and say a few words.
Thank you. Good afternoon, everyone. Good afternoon. My name is Mike Rossman. I'm a Senior Community Relations Representative at HealthNet. At HealthNet, our purpose is to transform the health of our community one person at a time. This means working with neighborhood health centers like community medical centers to improve access to care for every Californian. This especially includes our neighbors living on the streets who are already facing many challenges, which have only been intensified with the recent pandemic. We're excited to see the launch of the CMC CareLink mobile health van, and we look forward to seeing its positive impact on San Joaquin County's homeless population. On behalf of HealthNet, we're excited to help community medical centers get this mobile health van on the road and ready to meet the needs of our most vulnerable residents. Thank you.
Thank you, Michael. This time I'd like to introduce Randy Pinelli, our Director of our Healthcare for the Homeless program, and Randy certainly can give us a better idea of how this van will be utilized in the coming months.
Thank you, Christine. I'm, again, Randy Pinelli. I'm the Director of Healthcare for the Homeless for Community Medical Centers. I started this position in actually 2001, Christine. We've been out almost 20 years providing healthcare services to the homeless, area shelters. The last few years we've had the partnership of Stockholm, also community representatives from a number of agencies, a number of community-based organizations. Michael, we want to thank you and HealthNet for the van. It will go to good use. Part of the goal for this is to be able to get us out and give us more of a presence. Although a lot of the homeless recognize my Prius and Brandon, our outreach workers, Jeep, this is a lot better. So it also will give us an opportunity to, on days like this, have some air conditioning and have a little privacy when we're actually conversing and talking with individuals about this, for them to have a little privacy. Also, come winter when it's raining and sloppy, this will be really nice to be inside. So again, we do greatly appreciate HealthNet's contribution to our efforts. And this isn't the first time. HealthNet has been a partner over the years supporting our CareLink program. Martha Garrity and a number of the team from HealthNet have been advocates of what we're doing. And again, I didn't prepare any statements, but I did want to just thank everybody that came today. Also, all of our community partners are out. Our team today is out in Lodi doing outreach with Lodi PD and a number of other community agencies. But we do look forward to putting the van into use in the community. So thank you again.
Thank you, Randy. Very nice. At this time, we're going to get set up for our stay, because as we cut the ribbon, instead of getting to walk into a new building, we're going to throw the door open, and you'll get to come and see our new van. So could I please have the ribbon cutting crew? At this time, actually, I would like to introduce two of our community medical centers board members. Jasmine Leak is our new president, and Robert Smith is our vice president. Please come. And you have to get to this point, needs to cut. Ruthie and Ben, you guys want to come help? And wow. There you go.
Cut down. Cut down. Cut down. Yes. That's a picture straight. Really tight. Ready?
Go a little tighter. There it is. Yay! I need a haircut.
Yeah, go ahead. I'm just gonna hang out and see what they do.
Yeah, I'm excited.
I'm like, I feel like the suspense is coming.
I want to hear more about this. No, I'm
Well, at this time, I'd like to thank everybody for coming, especially we'd like to again to thank our chamber members and KCRA and the record. And if I've left you out, I'm so sorry. But thank you for joining us today for this, our very first virtual ribbon cutting event. Thank you. And wait, one last thank you. I also need to thank two very important people. Ginny Rodriguez-Moore and Maria Flores, who helped plan and put our event together today. So thank you very much. Go for it, Randy. Is it lost?
additional.
Of course, actually, there's a couple other folks while we're trying to find a key. We need to thank Bob Castillo, Robert Castillo, who took a very empty van and turned it into what you will be seeing today. And Roger Phillips, our director, communications manager. Thank you.
Bumper adapter, the trailer hitch, I haven't got it in yet. We're gonna put a hitch on there, I got a basket that's sliding in.
Oh, okay.
Come and carry